all 500 of you, to CEDA's Reimagining Workplace Mental Health live stream. We'll be discussing some really important issues today, the current and emerging challenges in our workplaces to improve mental health and create workplaces that are fit for a reimagined future. Before we start, a very important acknowledgement. CEDA acknowledges that and every day we are on Aboriginal land. Committed to recognition and reconciliation, we respect elders and we support their stated aspirations. I'd also like to acknowledge PwC for their support of today's event on behalf of CEDA. Thank you very much, PwC. As we move towards the close of 2020, I'm sure many of us will probably be happy to see the close of 2020. CEDA's 2021 program will continue to offer a diverse array of discussion forums, both face-to-face and virtual, to allow all of us from all corners of the country to participate and to inform and promote debate on critical issues. To keep abreast of the range of events and discussions on the most important issues facing Australia's economic and social development, please visit CEDA's website. It's at ceda.com.au. There you can register for upcoming events, and you can of course watch recordings of past live streams. And they're excellent, I commend them to you. CEDA also produces regular podcasts, video interviews and blogs with leading experts and policymakers to ensure that all of us can remain up to date with quality information on key issues impacting the economy more broadly. And all of that is available via CEDA's website. So please take a look if you haven't done so lately. Today, as at all CEDA events, we will be able to interact with our speakers through the Q&A portal, which is available via the link which is below the video on your screen. Or you can enter the details by going to ceda.pigeonhole.at and using the passcode mental health, all one word in capital letters. So that shall give you access. Please post your questions and vote on the questions of others. And there is a very important thing we want to ask everybody today, which is the poll question. So the poll question is, what in your view is the most crucial action to better support workplace mental health and wellbeing post the COVID-19 crisis? So really love to hear everyone's views about that, and we'll reveal your results at the end of the poll. So I'll just sit tight till the end and we'll share everybody's thoughts about that. You can also join the discussion on Twitter by using today's hashtag, which is #mentalhealth. And please, if you do so, tag CEDA at CEDA_news. Okay, let's get started. I would like to extend a very warm welcome to everyone joining us online. And as I said, 500 people. So this is obviously a topic of great interest to all of us. And I'd like to introduce and welcome those leading our very important discussion today. So our participants today are Lucinda Brogden AM. Lucinda is the chair of the National Mental Health Commission. Welcome, Lucinda. We also have Professor Ian Hickie AM, co-director Health and Policy of the Brain and Mind Centre at the University of Sydney. Welcome, Ian. Steve Worrall, Managing Director of Microsoft Australia and Chair of the Corporate Mental Health Alliance in Australia. A warm welcome to you, Steve. And also joining our panel discussion a little bit later will be Kristin Stubbins, who's a partner at PwC. So we've got a fabulous lineup. I'm so interested to listen to everyone today and to learn. So without further ado, Lucinda's going to start our discussion today. She will give us about 5 minutes of some opening comments, followed by Ian, and then followed by Stephen, and then we'll move into the panel discussion. So without further, Lucinda, over to you. Thank you very much.
Thanks, Leah, and thank you for the warm welcome, and thank you for the incredible interest in the CEDA community, that we've got so many people online today. I'd also like to thank PwC for supporting this great event. It's their own work in this area is really exemplary, and to be putting this session on and enabling it is so important. I'm on the lands today of the Gadigal people of the Eora Nation, and I pay my respects to their elders past, present and emerging, and also acknowledge those of us in the audience today with a lived experience of mental illness and those that love and care for someone on that journey. Today, I'm going to just focus on a tiny bit of the Productivity Commission report in the context of mental health and workplaces, and then I think Ian's following me with a broader rundown of the reform agenda in that regard. So most of you will be familiar with the fact that the Productivity Commission released its largest report ever ever in their work, and that focused on the costs of mental health and suicide in the Australian economy. And I stress that it's a report that looks at the economic costs. We know that there's incredible social and emotional costs that go with this topic, but their remit was around the economy and productivity. There's 1,600 pages, so I don't expect everyone to be well over that, although Ian is all over it and he'll follow me on that broad detail. It was in 3 volumes. It's 24 chapters. So where do we start in that regard? I'm going to focus today on just a couple of the chapters, particularly chapter 7 and chapter 19. Chapter 7 looks at the workplace issues and chapter 19 looks at income and employment support, which also ties into this strategy. I know that most people on the call are already very much on board with the need to create strong mentally workplaces that are beyond psychologically safe, but really allowing their employees to be their best selves at work and when they leave work. And the Productivity Commission recognised this in their report. They talked about the two-way link when it comes to mentally healthy workplaces, that there are opportunities to support prevention strategies, but also important to support people in recovery. And I think it's important that we recognise that sadly in Australia, while we're doing great work, the OECD reports that we have one of the lowest levels of participation living with mental health issues when it comes to employment. So for all of us, there's a great opportunity to do more, and that has great, strong economic benefits, but really powerful social benefits to our society. The Productivity Commission identified, and I think it will now become the gospel number, that mental ill health and poor management of mental illness in workplaces really costs the economy and businesses $17 billion a year. We've often liked to debate the semantics around these numbers, but it's a huge eye-watering number. And it's a number that if we think about what goes in the GDP of any country, it's the outputs of all our businesses and organisations. And if we think about the opportunity cost that sits behind $17 billion, when we acknowledge that mental ill health is really preventable and people will make good recovery, there's a huge opportunity for all of us to see that money going to our other investments in the long term. The productivity also highlighted that there's high returns for our businesses in getting this right. We reduce costs around absenteeism and presenteeism. $7 billion alone in presenteeism. And by what I just want to anecdote in this that I met a couple of years ago with the managing partner of a professional services firm, not on screen today. And he said to me, Lucy, when you talk about these numbers, that's not real money. And I was intrigued by the notion of not real money. And I said to him, well, here's the thing, if I save you any of that not real money, I won't charge you a fee, I'll just keep the not real money that I've saved you. And I think what the Productivity Commission is showing in this chapter particularly is these costs are real and they flow to your bottom line and they impact returns. And so it's important that if you need the financial argument, the Productivity Commission report sets it out in black and white, that there are positive returns to be made on investments in this space. There are significant costs around the cost of claims, and the Productivity Commission looks particularly at the workers' compensation system in this regard and makes some recommendations there. And it's just important to dwell on this for a moment because we know that around 6% of the claims are mental health related, but they're the most expensive claims and people are off on claim for longer. And we know that the longer someone's away from work, the longer they'll be away from work. And really good recovery comes when we can bring people back to work. It does intrigue me that notwithstanding the great work that Kristin's doing through PwC, that Steve's doing at Microsoft, that the Corporate Mental Health Alliance is embarking on, we still come across organisations that are a little surprised that it's actually the law that they provide a psychologically safe workplace. We have model legislation across most jurisdictions, and even where we don't in Victoria and WA, they still have provisions in this regard to provide that psychologically safe workplace. And so I think that the Productivity Commission bears this out quite well to show that it's the how. How do we do this? That is where Australian businesses are generally struggling. And I think there's an opportunity for some conversation here and ongoing work to really look at those issues. Work that I've done in conjunction with the collaborative partnership on the health benefits of work led by Comcare actually shows that a survey undertaken by the Department of Employment highlighted that actually less than 50% of Australian businesses felt equipped to return someone to work after they'd been on claim, and particularly with psychological issues. And so there's a real opportunity for us to skill up all our workplaces in that regard and understand what's going on. And I would challenge some of you to just think about your own organisations today and what does your return to work rate look like in this space? How well are you actually bringing people back to the organisation or onboarding new employees? Tony LaMontagne and other researchers in this space and academics have promoted the integrated approach. And again, the Productivity Commission in Chapter 7 talks about this. This is more than my hashtag of yoga and fruit bowls. This is taking an integrated approach. It's looking at primary interventions around good job and work design. It's looking at the secondary issues around treatment in the workplace, and finally at a tertiary level, good return to work practice. In 2017, the New South Wales government undertook a study in this space and found that only 9% of New South Wales businesses reported that they actually had an integrated model to support mentally healthy workplaces. So again, we see pockets of good work, but some really great opportunities, and that's supported by the work of the Productivity Commission. The barriers consistently, and it comes through in this report, are around the what and how. And we'd like to think we've got some of the answers to that through the work of the National Mental Health Commission and the Mentally Healthy Workplace Alliance with the National Workplace Initiative. There are a number of people that the call to part of our working groups, really developing a toolkit and strategy on the capacity to protect, prevent and promote issues around mental health and wellbeing, psychological safety, taking it from a compliance place to a much higher and more aspirational level. So I might leave it there, Leah, to focus on the issues around Chapter 7 and the chapter around income support, and really say huge opportunity for all of us to embrace the opportunities articulated in the report and further.
Thanks very much, Lucy. Ian, we're going straight over to you now.
So I hope you can see my screen. I'm too coming to you from the lands of the Gadigal people of the Eora Nation. I just want to step back a little bit from where Lucy's into the workplace issues to give people a sense of the national issues. The bottom line of which is we weren't doing that well pre-COVID. Now COVID comes along, the challenges are huge. So unless we're able to engage the whole population right across the lifespan and do things differently in the 21st century to the ways we did them previously, we're not likely to make much progress. And the challenge is large. Really, the better terminology is to talk about the mental wealth of nations that we have. And if you look at the science overall, what's to be done to build our citizens' cognitive and emotional resources so that we all thrive and flourish economically and socially. And I want to pick up that little 5-word sentence, early interventions being key. That doesn't necessarily mean early interventions in the health system. And it doesn't necessarily mean with children and young people only, which is often how early intervention is interpreted. It means whenever things go wrong in people's lives from a cognitive and emotional point of view, they're likely to be in trouble, and actions taken quickly in self-care, within context, within things like workplaces, are therefore not only likely to result in good health outcomes, but really importantly, in social and economic outcomes. So not actually just seeing this as an issue of access to the health system or professionals, but what is happening in context. In the world I'm in, we often say we don't get well to go to work, we go to work to stay well. You need to be within that context, and picking up Lucy's point, the workplace needs to operate in that way to promote wellness. Pre-COVID, we used to talk about ourselves being economically fine, but the issue about whether we were really fine socially, economically for different groups, young people in Australia, regional communities in Australia, was actually quite questionable. In fact, if you go to the 2019 figures just released by the Australian Bureau of Statistics on potential years of life lost, most people would be surprised to find that suicide far outranks heart disease and cancer and other areas in potential years of life lost, because it's affecting younger cohorts. And most of those people will in fact be of work age, particularly in the 25 to 49 type age groups. So young people at work in the primes of their life, we lose the most lives. And that social and personal cost is huge, but the economic cost is also large. As pointed out by the Productivity Commission and many others, only a fraction of those will actually be in contact with the health system and receiving care, although many may be known by family and relatives and others to be really struggling. And unfortunately, pre-COVID in Australia, suicide rates were trending upwards, particularly in younger cohorts. So despite all the efforts of people like myself and Lucy and many others, we've really struggled actually over the last 5 to 10 years. And in younger cohorts, importantly, those factors seem to be actually deteriorating. Now, the Productivity Commission report is a critical landmark report, along with a series of others. We have the Victorian Royal Commission, we've had other reports, there are many ongoing. But it does actually set out the framework, as Lucy has mentioned. And I think importantly, for the first time in a national report, it really says the workplace is really important, but also we've got to do things differently, create that social environment. It's great to have Steve here, use technologies in a different way, empower people and communities to take actions, not just access the health system. Now, for those who do need to get healthcare, that needs to be timely and effective. It needs to develop quality outcomes. And the outcome is you're going to live a longer life, but live a more productive life. So it's a return to full employment, to full participation. That is better by never losing your job in the first place than actually trying to recover from a psychological injury, etc. So that's shifting from just recovery after injury to actually equipping people to stay in their works, in their families, is a critically different perspective. And the costs associated with that, or the gains, as the Productivity Commission has highlighted, are clear. Now, I've got to say, that was pre-COVID. From a mental health point of view, there aren't many worse things that can happen than COVID. To totally throw our economy up in the air, to totally disrupt education, workplaces, our social environment and social supports. So we're one of those groups that's saying, well, how bad can it be? Well, it could be very bad, but it depends what we actually do. So supporting employment and supporting the scaffolding, the social environment around work in the current situation now remains critical. Adapt. What governments do at a top level really matters, but how every workplace in the country, how every school in the country, how the social situation where you live, whether it's in the Northern Beaches with Lucy or the Central Coast where I go, or southwestern Sydney or far north Queensland, how you do things in those communities really matters. And workplaces are key parts of the social in that area. We've been looking at what's likely or could happen in worst case scenarios in this situation with unemployment going up, etc. What really matters, of course, is government support for employment programs, but employer support for keeping people attached to work socially as part of that. So JobKeeper has been very important, not just for the financial aspect, but connecting people with the social fabric of work and continuing on having confidence about that. In addition, the actual support for tech-enabled enhancement of care and organisation of care. So it's great to have Steve here because actually, in addition to the traditional social scaffolding, one of the most important other things that emerges from our modelling is the smart use of technology to connect with people, provide care, organise care when that's reported, but also promote social connection, the way in which people stay in contact with each other in these very challenging times. It matters what governments do. For example, supporting JobKeeper would be a really good idea, but it's also is Job Seeker and extending that. But actually what communities do, and in this emphasis, in this setting, I really want to emphasise what workplaces do for the social support in this new environment will remain critical, and how they adapt. And I'd say particularly, just imagine this crisis without technology. If we didn't have all the ways we've stayed connected to work, to school, to each other. Just imagine a pandemic, Spanish flu, 1919 style. We've got opportunities here, but what we do right now also really matters to what the outcome will be in the post-COVID situation. Thanks.
Thanks very much, Ian. Stephen, we're over to you.
Good on you, Leah. Thank you, Ian, and thank you, Lucy. It's 3 for 3. I'm on Gadigal land as well, and using the theme of NAIDOC Week, always was, always will be. But let me, Leah, if I might, just highlight two thoughts, and then we'll get into the Q&A. First might be just some reflections on my experience or our experience at Microsoft and working with our partner network and clients across the country through this period. And then I'd love just to give a quick overview of the Corporate Mental Health Alliance. And then, so starting with the first, I think to Ian's point, there's a real conversation here to have about the role of technology. I might leave that for the Q&A discussion. because while there are no question many examples of how technology has helped during this period, there are also question marks about the role of social media and technology more broadly in contributing to some of the issues that we see around us. And so I think it's a question that needs further discussion. But in terms of Microsoft's experience, I think, we went through quite a lot of the similar steps that many organisations across the country have been through over the last 9-10 months in particular. We've been talking about mental health as a topic for some time, of course, but this year I think tested us in all sorts of new ways. And I would just reflect on some learnings from the year. At the top of that list would be the thought that each and every one of us have reacted to this year in a range of different ways. And talking to Genevieve Bell from the ANU, I think she said it best when she said that we can't totalize the experience that we are having either as an organisation, a workforce or a society, because the implications are so personal and so unique. And I think that's a really important theme and issue as we get into a conversation about mental health, is acknowledging that reality and then responding in kind. I also think it's fair to say that, as I look to the future, I'm incredibly optimistic and positive about where we're going, if only because of the experience that we've had, and that there are many positives that will come out of a year that we'll all want to put behind us, a year that we hope is never repeated again. But the sense of collectivism, the way in which our community, our country has pulled together, hasn't been perfect. But you don't have to look too far around the world to see how other societies and other countries are dealing with this time. And I think there's a lot there that we can build on as we head into 2021 and beyond. And so perhaps, some further conversation we can get into there in regards to Q&A. Maybe the second topic, and I'll just be brief in regards to the Alliance, the Corporate Mental Health Alliance is by 15 organisations here in Australia. We've been talking about it over about a 2-year period, getting the necessary support and pulling all the right players together. And we launched the Alliance just, last month, back in October. And the Alliance is intended to do two things. One is to share credible practice. I think none of us would suggest that we have best practice or that we have the answers, because that would completely misrepresent the reality. But I think each organization, including Price Waterhouse and Commonwealth Bank, Bunnings, Coles, Woolworths and many others, we've come together acknowledging that we can learn a great deal from each other, because there's some amazing things being done in the corporate around Australia in terms of addressing mental health issues in the workplace, and obviously the important role that we play as employers to ensure that we do, as Lucy said, which is create the most psychologically safe workplaces that we can, but to go beyond that, so that our teams in whatever organisation across the country can literally be at their very best, either at work or at home. The second effort that we want to pursue is to be expert guided but business led. And that's why we're so privileged to be working alongside Lucy and Ian and others who are professionals in the mental health landscape to help guide us in regards to how we might conduct research or to trial new approaches, or indeed to think about how we can continue to raise that bar. And we look forward to working, obviously, as an alliance to do just that. But importantly, maybe most importantly, this alliance is not a 4-member organisation. We've come together as a collaborative who want to and expect to be able to provide all of what we learn to everyone, every organisation across the country, just as indeed we hope to learn from the many organisations across Australia, private and public sector, that are doing such important work in response to a lot of the research and effort that Ian and Lucy have been leading over so many years. So let me stop there, Leah, and I'll pass back to you.
Great, thank you very much, Stephen. That was very interesting, and for everyone, I'm really grateful for your opening comments. Well, we're going to move into the Q&A, and at that point, Kristin Stubbins from PwC is going to join us as well. So, just to if you have questions for our panel, please just let's get them out now. Otherwise, I have 100 questions that I could ask, but I don't want to monopolise all the time. So let me ask the first one that's come through from one of our participants today. And maybe I'll just ask this one, and first of you to put your hand up, I'll let you answer. So what can workplaces do to tackle the survivor guilt that can exist with individuals who make it through COVID-related redundancies? So that's the first question. There's an economic one there. Stephen, is that you nodding? Do you want to have a tackle at that one?
Yeah, so what can organisations, the first part of the question, Leah, was?
What can workplaces do to tackle the survivor that might exist with individuals who make it through COVID-related redundancies?
Well, look, I think I'm very happy to take a start at this, and I'm keen to hear from the others as well. But I think as workplaces, we want to cater for everyone. As I mentioned in my opening, not totalising the experience, that is, not expecting that we can understand exactly how someone may be reacting, whether they have survivor guilt or whether they're dealing with one of the 53 million other reactions that you might have to this time. I think what workplaces can do and what employers can do is demonstrate a real consideration for and a care for the mental health and, broadly speaking, the well of their teams. And I think, as easy as that is to say, we know how challenging that is to create in the real world in which we live. And so I think that's part of why the Alliance has come together, because we know we can do more and need to do more, especially in context of now, Leah, coming out of our health crisis and thinking about the economic recovery.
Yeah.
We have a wonderful opportunity to rebuild and recreate. And I know many, obviously all of us here today, are very passionate about creating a more equitable and fair environment and society in future. And that starts, I think, in many cases in the workplace.
Yep. Thank you, Stephen. Kristin, welcome, and thank you so much for joining our panel discussion today. I have a question for you. If I'll direct this one to you, but others please contribute as well. But here's a question for you. So how can we raise mental health awareness whilst we're all working remotely and in this difficult situation that we find ourselves in? So maybe what are the extra things and the other things that we need to be thinking about when we're all at home?
Yeah, thanks, Leah. I might just sort of share some experiences we've been having at PwC and some things we've been experimenting with in that regard. And we wouldn't claim to be best in class. Like Steve said, I think we're all on a journey with respect to mental wellness. I think it is the issue of our time. And I think talking about what we're all going through is a sort of fundamental baseline thing that we can all focus on. So some of the things that we've found have worked really go to quite structured communications when we've been working remotely. So I personally led a team of over 200 people with a big deadline working through March and April. So we were right in the thick of it when COVID hit and when we went into lockdown in New South Wales. We've continued on with various other work, and we've had Melbourne colleagues, obviously, who've been in lockdown for extended periods of time. And so the sort of practical things that we've found have worked is structured huddle meetings, so connection points with team leaders. So team leaders on the ground having, lots of conversations, checking in, really caring. It goes beyond just checking in, caring and understanding, what's going on with individuals and trying to look for those trigger signs and have sort of personal conversations, which sometimes can be quite difficult over a Zoom meeting, as you can imagine. The other theme that I would say that's critical to this topic, and all of the founding members of the CMHAA have said this: leadership. So tone from the top in terms of, it's okay to talk about mental health. And if you do want to visit the website, it's cmhaa.org.au, and you will see some videos there of senior leaders in the Australian business community opening up about their own experiences with mental health. And we've found that actually gives permission for people to start to talk about what they're going through if they see their leaders opening up about this as well. So all of the leaders out there today, I would challenge you to be vulnerable and to share with your teams what you're going through, because people will start opening up to you.
Leah, can I just add to that too? Our friends over at Super Friend produce, I think it's 6 years now, what they call indicators of thriving workplaces, and that report's out and available on the Super Friend website. But one of the things that highlights for this year when their report was undertaken was this assertive outreach by leadership and teams to remote working has really been lifted the scores, and that's kind of counterintuitive, but people have really appreciated the extra effort that their team leaders, their managers, their supervisors have really made to check with them. And so I think there's some really positive learnings to take from this in that regard. And if people want more detail, it's cut by industry, see where you rank.
Okay, well, thank you, Lucy. And it kind of begs the question then, it's a nice segue back to you, Stephen. I wanted to ask you a question about technology, because the way in which many people have reached out has been on these kinds of platforms. There's the positive, and we imagine COVID without all of the things that we've got. As you say, it's a difficult thing to imagine. But I'm also interested in the negatives on technology. And what does that look like? And you're uniquely tell us a little bit more about that.
Thanks, Leah. And look, I think I'm in a position to offer a comment and a perspective, but technology is so ubiquitous today that I think each of us has our own point of view here, and I think this is a really important question. First of all, yes, there's no doubt that the world is becoming more digital, and we've seen organisations coming into the pandemic that were further advanced on their digital journey were quite frankly better to the challenges than those that weren't. We've seen a rapid acceleration of information through this period, and every one of our lives is involving more technology today than it did even 6 months ago. That acceleration is only going to continue. Yes, education was able to continue, health services have been able to be provided, people have been able to feel connected across this remote country of ours, and so there are lots and lots of positives. But you bet, it's ultimately about acknowledging that technology is a tool, because there are also other implications. There may be some on the line who've watched Social Dilemma, which is a program on Netflix, which has garnered a great deal of attention about the implications of social media. And I don't intend to prosecute the case here today. But there's no question there are implications for us in regards to the negative outcomes that have accrued as a result of technology. And there are some pretty clear signals that they are accruing to us here in Australia. So I think the acknowledgement that technology is a tool, ultimately, when you boil it down, and that it can achieve both good and bad, is really important, because we want to be very thoughtful about then maximising the positive impact and then analysing and understanding where it's having unintended consequences so that we can mitigate them effectively across our society.
Leah, can I make a comment on technology as well? When you step back and look at the Productivity Commission report, and I know that both Ian and Lucy talked about the tomes that are there, but there is actually quite an easy read executive summary that I would recommend that you all have a look at. The key themes that jump out to me around our society in this respect are, we need to look at prevention and early intervention. We need to look at getting people who need care, that right care at the right time. And a key theme is we need to equip workplaces to be mentally healthy. So we've talked about that. And technology can have some negative implications on our society. There's no question, Steve, I agree with that. But I also think it's going to be the solution, because you can't possibly employ enough people, enough psychologists. We just do not have the ability to have the infrastructure in place right now to just keep doing the same things we've been doing to tackle this issue of our times. So I think it's really a technology solution combined with understanding the care pathways that really sort of is the end solution here. So I think technology is in a way contributor, but a contributor to some of the issues. Although I would argue that a lot of these issues have always been there, they're now really surfacing. Yeah. And I think technology will be the solution in the end, combined with the right clinical support.
So, Leah, can I just comment about that? Because a lot of things
Yes,
are said
Ian.
about technology and mental health and asserted that they're true when actually they're actually unknown. So the relationships between technology and mental health in different developmental age groups and different age groups, these are active social pressure, issues. And a lot is actually unknown and unresolved, probably reflecting the reality. There are a lot of upsides and there are potential downsides in a particular issues, but it is the something of the age. And technology exists within media, it exists within social settings. So the use of the technology in the way it's been used in the US or in certain sort of social groups is not the same way that other societies are using it. So this is an active thing. But Kristin's point is critical. I'm part of the World Economic Forum group on the use of digital technologies in health and then in mental health. The transformation of healthcare to make it more personalised, more accessible, more effective, and delivered in ways and at scale that has never been possible under clinic-based or, what we might call real estate-based models, etc., and highly professional dominated models is radically able to change. Now, how to do that is an active process, and how to optimise that is an active process. And so this will be one of continuous improvement and development in those areas. So I think the issue is, how do we learn to use those tools most effectively to increase access to care, early intervention, effective tracking of care, and really the tracking of individuals to optimise that in much more empowered ways. It's a very active kind of area. So I think there's a kind of fearfulness, and mainly in the work we do, the fearfulness is amongst clinicians like myself who are terrified, partly being out of business, partly being dinosaurs, but partly, of course, because of the human belief about that human interaction is essential to certain aspects. I say social connection is essential to human well-being and flow, but how that is now best constructed and the way we connect, I'm sure others like myself connect with relatives all over the world in all sorts of places at the moment that are locked down and are separated, and we may not see it. I may not see my own grandchildren or some of my own relatives for some years in the current situation who are. So, it's the social connection aspect of technology in particular and the socially appropriate use of that technology that we're still on a journey to understand.
Thanks, Ian. And I have another question for you, because you said in your presentation earlier that we've arrived at the place where workplace matter for work health, for mental health. They're an important element in this equation in terms of what we do in workplaces. A lot of our viewers today want practical guidance. So here we go, some 3 tips. What is it that we should be doing in our workplaces to really up the ante on mental health? The Productivity Commission has written a lot about this. But if I were to press you, Ian, and maybe you as well, Lucy, if I were to press you for your top 3, people would love to hear what they are.
Well, the first one is actually the point Kristin was making. Workplaces are, in many people's lives, the most important social relationships and connection outside their family. It's not an us and them of employers, employees, etc., the hierarchical kind of notion of the workplace. Most of us rely on the regularity of work and the social connections to stay mentally wealthy. To not see it in such an industrial kind of framework,
yes,
and in such an industrial law or employer sort of framework. It is our lives. So I personally hate the work-life balance idea. I'm as alive at work as I am when I'm outside of work.
Good to hear.
And I think what's happened in COVID-19 is for people to kind of realise that, the regularity, the structure, but also the socialisation of it. So Kristin's point is breaking that down into human terms. Humans operate in small social groups, in teams, not in great conglomerates. So how does your workplace actually value the small world environments people live? The second is actually the monitoring one. How do you know how well your workplace actually is? What monitoring systems do you have? Work health and safety have all sorts of other monitoring systems, the air quality, the this or that, the risk. Very few workplaces have monitoring systems over their own mental health and well-being. Do you know the real-time health of the environment in which your people work, which people can tell you? You can actually use systems. We have these things. We have monitoring systems that we can use. And the third bit then is to support the earlier intervention when people are struggling. Because all the work in that area is people develop impairment often before they develop a threshold for clinical care, right? So they're in trouble in their social work. So that actually supporting earlier proactive action, whether that's self-care or it's transition, is critical. And I love Lucy's well beyond yoga and fruit. It's actually when you need to act, do you know how to act and where are the different levels of acting.
Thank you. Lisa, you must have to say on this topic as well.
Thanks, Leah. I do, and I think one of the things that I've actually learned working in the mental health sector, workplaces can really learn, is the concept of co-design. As Ian said, we don't work in a team of 10,000. Generally, we're working in small and structured teams. Allow those teams to actually design the way they're going to work that optimises the interactions of that team. I had a great boss years ago, and he said, I always have to remind my senior executives that they've actually employed highly functioning adults. We actually need to allow them to be those adults. They can make some pretty good decisions. We entrust them with billion-dollar deals. We entrust them with an awful lot. Let's actually entrust them with the way they're going to work as a team. And I stress the concept of a team because I think sometimes we go and pick off individuals and that then creates some resentment. So really think about allowing your teams to think about the way they work. The monitoring and the data is there and it's available and it can really give you those good snapshots. But I think cultivating that sense of team, that sense of safety, and as Kristin said, people sharing their vulnerabilities at work really creates that sense of safety and culture. And New South Wales government, again, plugging a government document, but has just released this week through the Treasury a really interesting analysis of what they're calling the new way to work. What have people valued out of this year? What do they want to take through? And I think it's going to be really at the peril of organisations that say, right, 1 January 2021, we're back to how we were. They will lose people. And that is not a good way to make a decision. So talk to people, ask them how they're best going to work. That in professional services environments, in a lot of organisations, but it can create a model that we can trickle across other industries and sectors.
Thanks, Lucy. Stephen, you mentioned, and everyone, in fact, all of our panelists have mentioned leadership. I mean, it is one of the key things and the thing that, very much emerges and distinguishes, I think, those who will fare well out of this and perhaps those less well. But I'm interested, you're the chief executive of Microsoft, huge organisation, you're, right at the top. What is it that you've observed or experienced yourself? I mean, I'm sure you must have some stories that you can tell us about where leadership mattered, what looks good, what doesn't look good.
Well, Leah, I'm not sure I'd describe it as what looks good or not, but so much as this idea, again, of Kristin's point about vulnerability and being authentic. We all have our own mental and physical health, and we all manage that in whatever way we manage our mental and physical health. And in a way, as a leader, I think one of my reflections from this year has been sharing your own personal experience and some of the stories that have impacted you can be a way of opening up a conversation with others in the team, or at least creating that environment where it's okay to have this conversation. And as simple as that sounds, it's still fair to say that there are many who don't feel comfortable in a conversation about how they might be feeling, reacting, or how they're dealing with the stresses and anxieties that they're currently facing in their work. Many of our clients, my clients, work in manufacturing or mining industries, and for years, decades, in fact, when you walk into a meeting, you'd sit down and what would happen would be you'd have a safety briefing. That is, we have a zero harm policy, and these are the practices that we observe. So wouldn't it be awesome to think that in future in our workplaces we'll have the same care and consideration given to the mental well-being of our teams and our partners and our supply chains, because we value it as much as our physical health. And of course we should. But look, maybe a personal reflection then, just off the back of that, Leah. My mother has been dealing with dementia over the last several years, and it's deteriorated as it's progressed. And I've just reflected on this year, the experience of going into lockdown, not being able to see her because she's in a facility, and realisation that there's a team of people, carers around my mum 24/7 that are looking after mum and have done for some time. But this year has just heightened my how privileged I am, and for that matter, many of us are with parents who might be or aged family members who are in care, to know that there are carers that have been going to work all day, every day throughout this period, organisations like mine are privileged because we use technology. In many cases, we can work from home or from other locations. But there are so many members of our community, first responders, but teachers in the health system, and certainly in the aged care sector, who get up every day, use public transport, go to work to look after my mum and well, thousands of other. And so, in sharing that story at work with some of my team, that has opened up a whole set of conversations for us that I think, and I hope, have enriched our ability as a team and an organisation to better address the mental health concerns that people have, noting that, as I said at the start, there's so many triggers and there's so many reactions. So, my story might relate to some, but it won't relate to the majority. And so it just becomes a matter of creating space for that conversation to happen, and then the many others to follow.
Thank you. And I think that's the important thing. It's almost an invitation to participate.
Yep.
If you're doing that, others will inevitably follow. Okay, here's a question. Think about your, we've got a colleague in the workplace who we look at and we think to ourselves, there's some mental health issues here. We might not know that they do exist, but my question to you is, how can we best support each other in the workplace? And look, there might be that there are different ways we need to do that in a professional services environment versus, a manufacturing environment, for example. Kristin, I'm thinking maybe that you might have something to say about this one.
Yeah, I do. And then I'll also defer to Ian being, the expert in this space in terms of what to do if you really are seriously concerned about someone. So I guess there's a range of things, and I work in professional services, but in talking to some of the other large employers in the Corporate Mental Health Alliance, I think these are sort of common themes. So in terms of, it sort of does come back to this theme of leadership, and it's what scaffolding have you set up in your organisation to really support individuals in teams. So, quite often we'll have team members who might think, well, I'm a bit worried about that person, quite sure how to approach them. And so we've set up scaffold that includes senior leaders talking about their own mental health issues and then offering to be available for conversations, to be very approachable. But not everybody wants to talk to a senior leader. And so we've also set up a program around mental health first aid. So training at quite a basic level, but still giving training to people in teams who might be more junior, who can look out for those signs, approach people, or be known as a mental health first aider, someone who can be approached. And of course, those people know where to go to in terms of the more scaffolding that might be in place in the organisation. So many organisations do have EAP or care support. Many organisations are starting to look at sort of online support as well. We have a dedicated website set up on our intranet for for mental health support and information on how to deal with things and where to go, and also how to maintain mental fitness. So it's about putting all of these things in place and having the leaders talk about them very openly and often. People are aware of where to go, and also importantly that it's okay to talk about it. And sometimes it's not fixable by the team. You might be having a bad day and you can have that fixed, but if there are serious issues, they do need to be escalated. So it is about trying to understand what are those warning signs to look out for. But I would defer to Ian because he is, obviously the psychiatrist on the panel.
I was going to say, Kristin, we know what not to do. So one of those important things not to do, you should get help, right? In Anglo-Saxon cultures, the you should not get help always results in people running away from help, like being identified as a problem. So Kristin's earlier comment really is, do you have the social architecture in place that allows the discussions, that people know much more about the context of people's lives? What else is happening? The idea we're going to be careful of is that workplace is the cause and workplace is the solution of the problem. Sort of classic sort of work health and safety kind of idea. When people's lives are very complex and they're being lived out at work, as well as in their other contexts. So the social architecture of who knows, the kind of horizontal thing Kristin was alluding to, who are peers, who are in social relationships, who has the best information, the vulnerability issue and the open discussion. So the more workplaces have situations where people have had issues, but they have not lost their job, they haven't been escorted from the building, they haven't been missing 6 months later, they've got effective help, whether it's related to the particular issue, and they have remained at work and recovered, that the social environment is not going to disappear from around you if you need help or you get care. So that kind of fundamental thing. Now, this I think relates to the proactive place of workplaces. If you're a workplace that has a dialogue going about that, that has the sort of mental health first aid infrastructure, has websites, not everyone wants to disclose to a person. Now, this is very hard for those from the personal caring industries to realise a lot of people would prefer to tell a computer thing, a checklist, or something else to seek information. So I think a lot of the issue is journeying with people. If you go to what has been most effective, it's being prepared to accompany people on a healthcare journey. And that journey now includes getting information from websites, looking at options, discussing what can be done, and supporting the journey rather than trying to solve the problem per se in the particular area. And if your workplace is set up in that way, then I think you'll be much more effectively able to respond to the range of options that a person may be willing to undertake. I think Steve had his hand up.
Just a very quick additional thought to Ian's comment there. Commonwealth Bank has had a digital platform in place for their mental health strategies and response for years. And it's now used extensively across the organisation. But it just makes the point that Ian was just sharing, that is, experiment and find the right way to engage your audience. And that's, again, an easy thing to say, but there's no rule book. And it's organisations like CBA who, full credit to them in the Alliance, have fully prepared to share all of their learnings with us all, because there's so much that we can learn from organisations like CBA on this for such a long time.
I would make the additional comment, however, about we have a problem with quality interventions in our area. So it's not just an issue of access to care. So I think really good workplaces have ideas about, okay, what other levels? It might be EAP, but also an effective trip into the health system. And actually, I think organisations being smart about that, knowing where good care, so from an employer point of view, if people get good care, they remain productive and they remain continuing in their lives is much enhanced. You know, whether we like it or not, in the mental health area, we have great variations in care, and that contributes to a loss of productivity. So I think actually not just being smart about initiating the journey, but actually supporting the quality journey. And it takes time. If there are serious mental health issues, they're not going to be gone in a few days or a week. You may have to require longer term support for people to fully recover.
And Leah, if I could just add to that.
Yes, Lucy.
First of all, there's some great resources that we've, the Mentally Healthy Workplace Alliance and the Commonwealth Department of Health have put together through the industry, and that if you Google COVID and mentally healthy workplaces, you'll come across those. They're for large businesses, small to medium, right down to sole traders. And there's some guides on supports, interventions, programs that people can access if they're struggling in their team or their organisation. And I think just to round out what Ian, Kristin and Steve have said is, don't assume that the colleague that you're worried about actually has the words or awareness that they're. And I think the greatest gift you can give a colleague is to actually notice that change in them and sit with them quietly and just say, Ian, I've noticed you're not participating in the meeting. Ian, I've noticed you're late to work, whatever it might be, and then make those inquiries. But don't stand at the water cooler or in the sidebar chat of a Zoom meeting and say, can you believe Ian doesn't notice this? Because really people struggling often can't, or they can't put the language. So please notice each other.
Thanks, Lucy. It's a really good comment, that one. And I've just got one more, but we need to be super quick in the wind up here. We're getting towards stigma. Stigma is something that comes out loud and clear in a number of different areas. And maybe back to you, Lucy. How do we deal with this in the workplace? What is it that we should be doing to reduce the stigma associated with these issues?
Leah, stigma is a really important one. I think for a long time, and the Productivity Commission did touch on the issue of stigma, Australians kind of got ourselves into a comfortable place because we were seeing all these great campaigns that we'd ticked stigma. I think what we've done is a great job at awareness raising, but we're still not there on the stigma. And I think some of the initiatives about people sharing their lived experience in the workplace are really important. But actually in the workplace, we have to mind our language too. Language really matters, and language builds the stigma. And so we need to think about the language that we're using. And, you know, all of us here on the forum today are people that have been around workplaces long enough to really call that poor language out in our colleagues. You know, educate people about the poor use of language, role model good behaviours, and that's the way we start to tackle it, and build in the education component. As I said at the start, actually we find that in our workplaces the level of mental health is very low. So something that all workplaces can do is skill up, not just the HR team or the WHS team, but across the board, skill up and learn.
Thank you. We've really pushed it right to the limit here, so I'm going to wrap things up today. And again, extend my very sincere thanks to each of you on our panel, to Lucinda, to Ian, Stephen and Kristin. Thank you very much. It's a real privilege for all of us to be able to listen to you and the insights that you bring to this very complex question. If we all had the answers, there wouldn't be even 50 of us on this call today. So again, thank you PwC for all the support you give to CEDA. I have the poll results. So again, what was the question? So which things are those most crucial to support workplace mental health and wellbeing post-COVID? Our response was this one, which is cultivating a more supportive and inclusive work culture. So culture, leadership, it's language, it's all things I think probably all get encapsulated in that finding. So thank you everyone for voting on that. You can continue to add any questions that you may have for our participants for the next 15 minutes or so, and CEDA will post some responses in the post-event email, and that will also contain a link to today's discussion and the complete results. I want to thank each and every member of our audience for your time and participation today. As Lucy said, I know that we're speaking to many of you who are converted, but I think it's the role of every single one of us to continue this discussion and really up the ante. I love your idea, Steve, about, you know, the safety share can be a mental health share. We should think about that. It'd be an easy adaptation to make to what we all currently do in the work health and safety space. So thank you very much. Back onto CEDA and its website and its programs, there's a whole lot of interesting things coming up for CEDA on Monday the 30th of November and Tuesday the 1st of December. There is a discussion, the Public Interest Technology Digital Forum, 14th of December. There is another session about optimising the rail system for the future and featuring the Deputy Prime Minister, Michael McCormack. So please go to the CEDA website. All of the details will be there. And also, please feel encouraged to continue this conversation by connecting with CEDA. CEDA is available, of course, on all its socials, LinkedIn, Instagram, YouTube, Facebook, and there's a wealth of information on the CEDA website. So I encourage everyone to have a look at that. So that's it from us today. We have about 30 seconds to go and get everyone back to their day at 2 p.m. here in Sydney. And again, a thank you very much to our panel and for all of you for participating today. Hope you've found it as fascinating as I have. Thanks, everybody. Good afternoon.